Right, so once again, welcome to this session, and you can see on my screen, this is our central user guide help page. So you can access all existing guides in there, and you can see the CAT Plus, which is the whole suite of tools, PenCAT, which is the aggregation tool, CAT4, clinical audit tool. A lot of people call it PenCAT. It is actually called CAT, just that, CAT4 now. And then there's Topbar, which we will be talking about today. When you go further into the user guides into here, you will see there's a number of different guides. The way we sorted them is general guides, and then each of the individual apps in Topbar, of which currently there are 5, has their own individual guide as well. So you can either expand that and then look into it, or you can just read through. All of this can be exported into PDF as well. And you can search for things. So if you wanted to search for diabetes SIT, for example, you can see that that comes up in the user guide PenCAT, it comes up in the CAT guide, and it comes up in lots of other different guides in there. So that's where this online help system is quite good, because you don't have to read all of the guides. You can just put in any keyword you're interested in, and that will bring it up through the search. So to access it, you can either use your browser directly, going to help.pencs.com.au, or much easier, from both CAT, which I'm just going to start, and Topbar. Oh, we've got an update coming in. Okay, I'll do that as well. While that's loading, I'll show you how to access the user guide from Topbar itself. So what I've done with my system, and that is an option for all of you, no matter if you're using Medical Director or Best Practice, you can link your Topbar login to the login of the clinical or billing system. So that works with Praxoft as well as Best Practice Management for non-clinicians, and with the respective clinical systems for the clinicians. So you can see the little tick box up here, log me in with the clinical or billing system. Currently there's no username or password in there. When you install Topbar for the very first time, you will have to then firstly log in once, and that has to happen when you're already logged into your clinical system, because otherwise Topbar cannot link the two. It doesn't know whose login should be combined with the Topbar login there. I notice there's some more people that have just dialed in. I've put everyone on mute. If you have a question, if there's any problem, or if you have a question to what I'm talking about, *7 will unmute your phone, and you can ask your questions, and I will do my best to answer. So I'm just logging into my CAT. I'm trying to. Okay. And as I said before, there are different ways to access our help guides from within the tools directly. This is just a startup. But in here on the dashboard, there's the CAT recipes, and there's also user documentation, which will get you straight into the CAT guides. And because what I said before, I've linked my Topbar with my clinical system with Medical Director. So I don't actually have to log into Topbar. I'll just log into MD in my case, and that will log me into Topbar as soon as MD is started. So we've logged into both clinical system and Topbar. You can see on the top there, the first app has already kicked into action, which is the waiting room app. So what Topbar does in there, it will look at who has arrived in the waiting room, and out of those, who have any notifications due, basically. And when we click on that, you can see what is prompted. And you can see we have 3 patients here with action required. We have 2 where their demographic record is complete. And what we're checking for, I'll show you by clicking on the patient name, you can see the details that we check. So for Moreton here, no gender in the record, no contact number, no next of kin, no Medicare number, no ethnicity. And we have all of the information below with the green tick. Yeah, so that's, you can see also the number of notifications. So Moreton has got the most items missing. When normally, because I've just added my patients in a rather rough way to the Praxoft waiting list, but at your clinics, normally you will also see the provider who the patient is scheduled to see and at what time they're scheduled to see that particular provider. So that will sort the patients by doctor name or provider name, and then in the time. And within that, you will still get the notifications listed as well. And so you can immediately pick who has more or less items missing. So what happens there, or what the idea behind this waiting room app is, obviously it's happening outside the consult room. This is for receptionists or other staff that are looking after patients before they go into the consult room. And we split it into two different tabs here. The second one, the clinical, is only available for people that in two conditions. They have to be a clinical user in Topbar, and that's something that is decided when the user account is created in Topbar, so before the first login. And even if they have clinical access in Topbar, we still need basically proof that the patient can actually open up a patient in the clinical system. And the way we're achieving that is it just says, please log into your clinical system and open a patient. So it's a double check so that people that cannot actually open up patients in the clinical system won't be able to see the clinical information in Topbar, because we gather that they're actually not authorized to do that. So that's the only trick there with the waiting list. And you can see now I have access to the demographic and the clinical tab. Now with the clinical tab, we're obviously looking at different items there. So the waiting room app is really for data completeness. This is based on the accreditation guidelines, what should be in a patient's record. And as I said, we split it into demographic, things that can be easily done at reception, for example, and can be entered by the receptionist, which is more important. And then the clinical tab in here. So that will show for everyone in the waiting room which clinical items or accreditation items are missing. And you can see there's things like alcohol, weight, height, smoking, family history, and so on. And in this case, only the allergy status and diagnosis coded gets a green tick. Just before I go into a bit further detail there, diagnosis coded gets a green tick as soon as there's one coded diagnosis. So this patient could have 20 free text entries in their past history, but because they got one coded diagnosis, that's fine. And this is really, again, comes down to accreditation guidelines, where the rules are that we get there should be a coded diagnosis in the patient's record, or there should be immunization information in the patient's record. It doesn't mean they have to be up to date. It could well be that this is an old entry in there, but what we're looking for is, in general, does this practice enter immunization information into the right spot in the clinical system, or do they enter any coded diagnosis? The rest is fairly straightforward. Is there an alcohol status entered? Does the patient have a weight and a height entered? And so on. But what is, of course, obvious from here as well is that these are not items that can be done at reception. That's definitely not the appropriate place, and certainly you couldn't start doing weights and height in the waiting room. So while this is still under the waiting room app, what is happening in a lot of clinics that are using Topbar is that they have a nurse or another clinician also having an eye on the waiting room app. And for example, in this case, because I don't have the providers and the time listed, but if my patient here, Mr. Guy, would have arrived 15 minutes early for the appointment, or we know that this doctor is running late anyway, what could well happen is that this patient, or maybe a couple of these, are seen before they're seen by the doctor, by a nurse in a different room, and these basic clinical items that people should have in their records, like asking about their allergy status, about the alcohol status, and immunization obviously can't really be done normally on the spot anyway, but this is just pointing out where things are missing. So this is where the waiting room works. It is people that are physically in the clinic but not in the consult room. They're still waiting to be seen, or they've finished their consult, and provided your clinic changes their status to in billing, then they will be picked up again by the waiting room app. So it doesn't have to be necessarily before the visit when they arrive. It could also be after they're done with their doctor's consult and they're waiting to be seen by an admin person for billing, similar things like that. So that's the waiting room app. I'll just unmute you for a sec, and if you have any questions, please speak now so I can hear you all. Any questions to the waiting room app? No, everyone clear on that? Fantastic. All right, back to mute you go. The last thing on here is the filters, and that's where each user of Topbar can customize which prompts, which notifications they receive. And remember, we're still only talking about the waiting room app. So this is not happening inside the consult room yet. That's going to be the next step. So you could say, like I've got here, the private health insurance. A lot of clinics are not interested in that, but a lot of others are. So again, that's a very optional thing there. If you want to be notified about missing health information, private health insurance data in the patient's record, then that would have to be turned on. And I don't know if you just noticed, but the little number of the notifications has jumped to a 10. If I turn it off, it goes back to an 8. So in other words, there's 2 people that are not up to date with their private health insurance information. There's nothing entered in there, and they are the ones that will receive an additional notification. And the same applies to all the others in here. Per user, so it does not apply to everyone else at the clinic. Everyone can customize their own prompts. And if you don't touch anything in the filters, then it will just show everything as listed. So by default, everything is on. So let's move on into the consult room now. So I'm opening up my patient. And you can see there's lots, or at least some things happening up there. We still have the waiting room up. We have the cleansing app there. We have the PHS app that never gets any notification. That is the patient health summary. And we have the MBS app, and that one has 5 notifications. A lot of doctors, and this is the first thing there in terms of settings, do not want to have the waiting room app running in the consult room, because their argument is we're focusing on the patient in front of us. We leave whatever happens outside to other people in the team, so we don't want to get distracted by this. To change that, under this icon here on the top right, you can click on that, and you can see these are the apps that are currently enabled. By just clicking disable, it will remove it, and that's it. And again, this is per user only. So the doctor taking away the waiting room app from his or her Topbar setup, it won't affect anyone else at the clinic. It'll still be running in the waiting room or in all the other rooms where it's not turned off. And again, because it's per user, it might be that another user shares the same computer. If they have not configured it to be turned off, it will be turned on as well. So the apps that are active now: cleansing, patient health summary, and MBS app. Let's have a look at them. And first thing, there's 4 tabs in this case, 1 more than in the waiting room app, but the content is exactly the same. So under the demographic app, we are we are notifying about missing items such as gender, contact number, next of kin, and so on. I didn't do that before. I can do it from here now. If I say actually add to clinical system, so I can put in an ethnicity, I can put in a contact number, a home number, I can put in a gender, I can put in, I'll leave it at that for now for the demographics. So what you notice in there, the 11 just jumped to an 8. So now the only thing missing is the next of kin and the Medicare number. So this is very quick. However, I've also been told by people that the doctors don't want to be prompted about the demographic information that should be done already when the patients come in and are seen outside the consult room. If that's the case, you could go as a doctor to the filters and just turn all demographic items off. And you'll see there won't be anything, and you only get clinical prompts now. And these are the things that we've seen before, again, under the waiting room app, like allergies, alcohol status, family history, and so on. So if I want to add that, 1 click in here. What we do with Topbar, whenever you click in Topbar on a link that says add in clinical system or similar, it will open up the correct entry form in the clinical system. So there's actually quite a few examples where this is quicker than using MDO best practice, because it will get you straight to the right entry screen. So in this case, no known allergies, we'll save. And what you should see is it's just happened from the 6, it went to a 5 because it's taken the allergies off, and so would the other ones be taken off. So that's the 2 that are identical, demographic and clinical. The third one is not available on the waiting room app, because this really is a clinical thing. And what you can see in here, we have, for this patient, there are 3 different potential chronic problems, but no diagnosis recorded. And there's diabetes in red, indicating that the chance is reasonably high. And we have a yellow for COPD and for mental health. So if you click on that, you can see why it's come up. So for this patient here, she's on a long-term prescription of metformin. She's had a high HbA1c and a not so low fasting blood glucose. So all three together are a strong indication that she does have diabetes. But when we look at her current diagnosis listing here, you can see there is a diabetes in there, but it's got a typo in it. It's got two I's. So it's not picked up by medical director in my case as a coded diagnosis. So in other words, free text is not recognized internally as well as externally. So meaning medical director does not know this patient has diabetes, neither does Topbar or CAT for that matter. Just a very quick jump into CAT in here. For those who haven't seen it, my apologies, but I just wanted to show you the similarities and where CAT Plus works together now. There is a report in here called data cleansing. And you notice here, this one's called missing demographics. If you look at what we're prompting in CAT, this is exactly the same as what Topbar does for each patient as they present. Missing clinical and accreditation items, same thing. Allergies, height, weight, and so on, exactly the same as in Topbar. And here are the four indicated chronic kidney disease, indicated diabetes, mental health, and COPD with no diagnosis. So CAT looks at your whole population, everyone in your clinical system, and in this case who would have indicated diabetes with no diagnosis. And you can see Moreton pops up in here, whereas Topbar does the same thing as the patient presents. And of course, that makes it a lot easier for these things. For the missing clinical items, or you can't do anything when the patient's not there, you can't measure them or guess their alcohol status. But for these things as well, I mean, this is then presented to the clinician, to the doctors, who possibly then are in the position to immediately either fix it. In this case, we could say, well, there is diabetes in there, it's just not been entered correctly, or review and say it might not exist. You know, she doesn't have COPD. It's because we don't say that we have 100% success with this. It's a very basic algorithm that says it looks like the person might have this chronic problem. It's by no means a full diagnosis. But let's say start with the diabetes, and I'm going into the clinical system now. So it will open up my screen on the past history, assuming I want to enter a new one, which is quite often the case. But in this case, we're actually fixing up the misspelled one in here, and I'll put in the correctly coded and descriptive one in there. So we're putting in type 2 diabetes. And one thing that happens here, as you can see now, the change from the free text entry to a coded one actually brings a drug interaction warning into place here that wasn't before, because only now does medical director know, oh, this person has diabetes and there is a drug interaction between Lexapro and possibly diabetes. So I'm sure you're all aware that free text coding, non-coding, the free text entry of any diseases is not a good idea for a number of reasons, but this is certainly an example of what happens even just if you never try to analyze your data using, say, our tools or other companies' tools. If you just stay within the clinical system, coding is still very important. So we fixed that one up. What it's done in here, it's taken the diabetes off the action required list, because we actually now have a properly coded diagnosis for diabetes, and we don't need to prompt anymore. The same would apply to the other ones. With mental health, we're looking at her medication, a long-term prescription. COPD, we're looking at also prescription of tiotropium, and we're looking at the spirometry results as well. So that's the indication tab in cleansing. Yeah, demographic and clinical, same as waiting room, but for one person only, the patient in front of me. And the indications is a completely new one that does not show in the waiting room app. Filters is the same. I briefly showed you before, and we turn this off or back on again. You can also change which indicated conditions are prompted for. And that's the cleansing app. I'll repeat my little exercise from before, so you're all back on the phones now. Any questions to the cleansing app? No, everyone clear? I mean, in general, it's not difficult to use. I guess it's probably more the question how to get into it and respond to the notifications and so on. But yeah, please feel free to ask anything that comes to your mind. All right, I'll mute you again, and we'll go to the next app. Patient health summary, that's a quick one. There's no interactions, there's no buttons to click or anything. It really just displays a summary. You can see the current condition, and that's where you now can see the coded diabetes type 2. You can see what medications the person's on, and also if they're active or inactive, which might be an important thing to consider, in particular because there's unfortunately the bad habit of leaving medications on the active list, even though they're not anymore. So that might help with that. And then a bit of some risk information and so on. But that's really basically it on the PHS or Patient Health Summary app. I didn't say that before explicitly. You can either hide or close the apps on the top right here, so that will hide it. Bring it back up by just clicking on it. Topbar will never cover your screen of the clinical system or anything. We never show more than what you can see now on my screen, just the black little bar on top and the number in the red circle. So the philosophy behind it is really that we know that people want to work with their systems. They want to put their progress notes in or look at results, whatever it is. So Topbar really is quite a discrete tool that sits there. It will respond to new patients being opened and so on, and will then display the number of notifications. Of course, what we're hoping for is that the users will look at that and go, oh, there's 5 notifications in the MBS app. Let's have a look what's there. But that's really it. So we're trying to be not intrusive at all with this. It is an add-on, not a replacement or anything of your clinical system. So with the MBS app, for my patient here, for Moreton, I have 5 relevant or 5 items there that require action. Team care arrangement review, the GP management plan review, the actual GP management plan as well, diabetes cycle of care and asthma cycle of care. All of these items are relevant to her. All of them are not up to date, those 5. We only have 2 up to date, team care arrangement and the medication review. And you can see by default they're hidden, but these are the other items that we prompt for in Topbar. And that would be things like the health assessment for type 2 diabetes risk. Now, before I made her diabetic, a patient with a coded diagnosis of diabetes, you would have seen that the diabetes cycle of care was under the not relevant, but instead we had the health risk up here because she's in the right age group. And of course, without a diagnosis of diabetes, we wouldn't apply the diabetes cycle of care. The GP management plan would have been in there anyway because she already has AF and asthma, but it's just added the diabetes to that list now as well. So always in Topbar, when you click on the items in one of these lists, it will expand and show more information, more detail to it. And you can see here, every 3 months is not met, and that's basically all we're saying for an item like the GP management plan. For the team care arrangement, that has been met, has been done in the last 12 months, so that's why there's no action required. A bit different for the diabetes cycle of care, and similar to the asthma cycle of care, we actually list the individual components, and some of them, like the BMI, is due twice within the cycle of care within the 12 months, so we list it as every 6 months, same as the blood pressure. You can see they're all up to date. You can see the foot exam, for example, there. That's not up to date, as are quite a few of the pathology, like the lipids are not up to date, and so on. Now, quite a few of these would be done by the lab and come down into your system automatically, and there's no need to actually manually add them in the clinical system. As the blood tests are done, that will update automatically. But there's a couple of things in there I'd like to point out. So even if you don't open up the details, and if you just look at this and you can see 5 out of 11 items are up to date, that would indicate that obviously 6 items are not up to date, and the patient probably would be good either to be seen soon again to have these things done, or maybe there's something that can be done during this consult. And it might not say 5 out of 11, it might say 10 out of 11, and the only thing that is not up to date might be an eye examination or a BMI or whatever it is, maybe something that can be done opportunistically during the visit now, or like in this case, it would require a blood test or several other things as well. So that's one thing in terms of making it easy for the providers to look at that and say, okay, we could finish this particular item during today's visit, or we need to make a new appointment for Maureen in this case. Once you want to actually enter results in here. And this is, I'll show you with the foot exam because that's probably one of the most impressive examples in there. Clicking on Add in Clinical System will open up, in this case, in Medical Director, the only screen that is it's the only right spot where this can be entered. Now, there's quite a few other things within other forms, other tick boxes within Medical Director where a foot exam can be entered, or one would think that it would count as such, but this is the only place technically where it should go and where we can pick it up from. So if it's not in here, if it's in the progress notes, it's lost anyway. Any free text entry in the progress notes is not picked up at all. And then there's a couple of other fields like that the patient has seen a podiatrist. That's good and well, but this foot exam is actually the one, the foot examination that's actually done at the clinic, not necessarily at a podiatrist, and that's why it's in this specific area only. Now, if you know the patient's gone to the podiatrist every 3 months and they had their foot exam done at each visit, I don't think there's a problem with you ticking that. But if it's not the right box, then it won't show up. So that would be where you enter the foot exam in a clinical system, or in MD in this case. And from Topbar, it's just one click away from here. I'll show you how, if you wanted to do this manually, how to get there. It's under Clinical, Diabetes Record. You have to start a new assessment. And it's not here, it's not here, it's not here. This is the eye exam, by the way, the ophthalmology. And then it's here. So it's about 8 or 9 clicks into the system, and that's where the foot exam is. By the way, 2 clicks further is the diabetes-related medication review. And that's even further in. And as a foot exam, we can get to that with 1 click from here. Because in my system, I've already done that one, the medication review, but if it would be overdue, then you could add it with 1 click in here. So I guess there's 2 things. One, it's quicker to enter, but the other one that is probably at least as important, if not more, if you use this, it will go into the right spot, in this case in MD, and that means it can be picked up by CAT when you do your data collections in the clinical audit tool, as well as in Topbar when the patient comes in next. So was there a question by someone? No? Oh, okay, that's no worries. Yes, I will. Okay, so that's the diabetes cycle of care. Asthma cycle of care is quite similar. It's just less items, 5 of them in here. And you can see this, they're lined up here and they have the same functionality, adding clinical system. To establish which items are relevant for the patient, we look at the age, gender, ethnicity, past history, what's been coded in terms of history, what chronic conditions in particular. We look at prescribed medications for the medication review, and of course the age as well, so that we can see if there are any health checks related to age applicable. The other tabs in here, like the activities tab, really shows the same information, just in a different format. And I'll show you an example here where you can see the HbA1c has got 1 red cross and 1 green tick. And the reason for that is that, still not scroll bar, sorry, it is a little bit further down here. They had the 6 monthly done, but not, well, they had in the last 12 months, they had 1 HbA1c done, but not in the last 6. And that's really the same with, say, the GP management plan as well. My patient here has got 2 red crosses, so she's not up to date with the minimum with the 12 months, and she's also out of date with the recommended 18 months. The reason why we put in 2 is that even though Medicare says you can claim a GP management plan every 12 months or a review for that every 3 months, in reality that does not apply to every patient. So we highlight both. We say the 12-month period is now overdue or up, the patient is outside the 12 months. In this case, she's also out the 18 months and definitely eligible now to have the GP management plan claimed. Same with the review, 3, and then if she's out of 6 months, in this case, well within the legal time frame to do this particular, claim this particular item. And on the last tab, on the claims tab, you can see what's ready for claiming. And this is based on, let me show you in the record, when you put a coded reason for contact in this case team care arrangement, that's where Topbar will pick it up from. Yeah, so that's why it says the team care arrangement is ready for claiming, as is the medication review. These are claimable if they are completed. And we can see the GP management plan. And the reason why it comes up in here is because I claimed it way later than I actually did the activity. When we're looking at claiming, the information we look at there is what's coming back from Medicare. So if it's not enough to just send in a claim, you actually have to receive a payment report or receipt, and that will then take off the item from the ready for claiming and say it's up to date now, until of course the 12 months or 6 months, whatever it is, passes and it becomes relevant again. So that's the MBS app. I can show you the prompts. Yeah. Do you want me to show CAT prompts as well? It's just I was a bit concerned about time, but I can try to make it reasonably quick. Maybe if you have another 5 to 10 minutes, happy to do so. Okay. All right. We'll do that. Okay. So I just assume I'll put you on mute again. Sorry. Doing it now. So I assume that you all have CAT installed, the clinical audit tool. And for those of you who already have Topbar at the clinic, there is a functionality that we've only released late last financial year, so late May. And basically what that allows you is to send a notification, a custom notification or custom prompt from CAT to Topbar. And I'll show you how that works. There's a number of things that you need to be aware of. Firstly, the user guide for that is split into 3 parts. It's split into CAT and Topbar and PenCAT. So what you need to do in terms of the easiest way to get there is if you go to CAT Plus, well, I guess the easiest is actually go to CAT, sorry, and type in prompts. And you can see here under the CAT Plus guides, but what we want is the user guide Topbar. There should also be a user guide for CAT Plus prompts. Yeah, so you see you have the CAT Plus prompts, which is a bit of a mouthful, in CAT 4. That will tell you how to create prompts, yeah, setting up CAT prompts, requirements, configuration, how to create a prompt. So this will talk you through exactly every step of the way. And that's what I will be doing now pretty much. So if you're in doubt, if you wanted to read up on it, head back to our help homepage and type into the main bar or into the one on the top right, doesn't matter, CAT Plus prompts, and you get, PenCAT is the one you don't need. That one is if any user that be on for the PHN side, but for you would be the Topbar, which displays the app, and CAT guides in CAT how you create them. And that's what we're doing now. First step is you need to be from the dashboard that will come up when you log on to CAT, you need to be in the daily view. And the reason is that in the daily view, we're using less reports in here, not the full range. And these reports are currently the ones that we can use with the prompts. And so I'll show you an example for a prompt there. You can use, and those of you who know CAT, you're probably all familiar with that, you can use any of these filters here. Let's say we're interested in active patients. We're interested in people that have a respiratory condition. We're interested in people that also are smokers. And we might only be interested in results in the last 2 years because we're after spirometry in this case. So if I recalculate now after applying that, and you can see in my little, I've only got 60 patients in here, there's only one person meeting this criteria, but that's fine. That's not a problem. We just need one. Under measures, you will find your spirometry. And you can see here, well, there's actually, this one person does have someone recorded. Let me just make my, make that a bit more open because I need someone with nothing recorded. No, there's still only one. Hang on. I've got another data set we can use. It's just loading, give me a sec. So basically the principle is that you create your normal anything you do in CAT, yeah, you probably, if you're using it already, you might have some saved filters already, some ideas on what to do with it. So we're calculating now. These are the patients that we're looking for, active patients with respiratory conditions that are smokers and the last results had in the last 2 years. And so you can see there's 79 people there, and none of them had any spirometry recorded in the last 2 years in this practice. So what we can do is now, as you in CAT normally you can do, you can bring up the patients behind the report. In this case, the 79 people with nothing recorded, and that will come up in our patient re-identification report. So you can see there's my 79 people at the bottom here. Oh, crap. Why isn't that there? Sorry for that. It should be there. Topbar and CAT need to be linked, but in this case, they are linked. This problem. Another day. I'm not quite sure why it's not happening, but let me see. I just need to see that, and it's not there. Sorry, I'm not sure what's happening. This is going to take me a while, and I don't want to waste your time. So if you can bear with me, so far the steps is exactly also described in the manual. We go back to my spirometry, and I bring up my 79 patients here. Just pretend with me that down here it doesn't say prompt at consult sidebar, that it also says prompt at consult topbar. And that's where you then can click on go and create the prompt. The prompt will ask you only one thing, and that's the message that is displayed as a patient presents. And that's all it is. So there's a free text field, and what should go in there is something. Let me just click on go in here. Oh, I can't do that, sorry. Yeah, it won't work for sidebar because we're not using that anymore, but it will just come up with a window that asks you for the name of the prompt, and that name is what will be displayed to the clinician if a patient presents. So a couple of things, I'll show you what it looks like first. I'll bring up a patient where I know there's a prompt in existence. That's a good question, Rebecca. I think you would have to have CAT also on the terminal server, but you can try if your CAT can connect to the Topbar on the terminal server. It might be a good idea to ring our support for that, but you can just try, and that would be done by going to edit, what I did before very quickly, edit preferences, and then under Topbar, go to edit and see if CAT can find your server. It might not work because normally they need to sit at least on the same network, and it depends how your terminal server is separated out from your normal network. But that would, you could get around that by putting one CAT instance onto the terminal server, and that would definitely be able to connect. So back into MD to open up a new patient, and that is Heather. So with Heather, I've prepared a prompt, obviously, and you can see once the patient is open in Topbar, and only if the patient meets the prompt criteria, this app kicks in and there is a notification in there. So clicking on there, you can see it tells me here, and this is the text I was talking about before that you create in CAT, where you type in high-risk respiratory patient, please do spirometry, for example, or, you know, patient hasn't had a blood pressure done in 6 months and has heart disease, or you know, whatever else you want to communicate really into the consult room. One of the things that often happens in CAT, that you do a search and you find a long list of patients that have maybe they need a particular health check done, or they at risk because of their medication or whatever it is. The problem is then how to communicate that list to the clinicians who actually see the patients as they come in. And that's what CAT Plus prompts allows you to do. So you can see the prompt is displayed in here. The clinician can either just look at it and, you know, possibly initiate the spirometry. They can also dismiss or defer the prompt. And in the settings in here, you can see which prompts are active. So there's a number that are quite meaningless: test name and respiratory and risk. Please check HbA1c, high risk diabetic, no EGFR in 12 months, and so on. So these really are just examples that I put in there, but I'm sure you get the idea. By default, when a prompt is created at your clinic, they are active for all users. And it's the same principle as we have with our filters in the cleansing app and the waiting room app. If, say, you have 5 doctors working at the clinic and 3 of them really like the idea of getting prompts, say, from a practice manager that works with their reports, but the other 2 say, no, we're not interested, they can just turn them off and they won't be bothered. But they would have to opt out. So it is an opt-out system for the prompts that you create locally. So I guess the message there is, generally speaking, this should not be just done without involving the practice team. Everyone should know that this is happening, but once it's in there, then the notifications will be displayed in here and then hopefully get some response. Just a bit more on the actual prompts. So what we created in here, you can also have a look under prompts, under Topbar. Okay, so I have to update my Topbar. And you remember when I logged in and the new CAT version was downloaded, so I have an too old Topbar on my system, that's why it doesn't come in. What it allows you to do in here, however, is to look at the prompts that were created, and you can see how many patients have been displayed, or if there's anyone dismissed or deferred. And you can see the criteria for the prompt. So the same thing as you can see in here by clicking on the prompt. So you can see that they have to have asthma, they have to be daily smokers, and nothing recorded in their spirometry. The nice thing about these prompts, if you create that today and tomorrow a new patient signs up at your practice who happens to have asthma, is a daily smoker and never had spirometry recorded, the prompt will work immediately when this patient presents. On the other hand, if, say, a patient with asthma stops smoking and that's updated in their smoking status, they won't get the prompt anymore because they're not listed as a daily smoker. And of course, if they have spirometry recorded, then they drop off as well, because that was the whole idea, to get the clinicians alerted to that high-risk patient that didn't have a spirometry test done. Yeah, so the prompts are quite smart in that respect, that they're not static. They look at the changes in the patient's record as well as new patients that are being added to the system. So my apologies for my too old database there. I'll just get you all back on the phone, so you're all back open lines now. So the key thing to get started is first connect your Topbar to CAT by going to Edit, Preferences, and then Topbar, and go through just click on Edit and it will guide you through. And the next thing is, once you've connected, you can only do this from the daily CAT. You can't do any prompts if you're in the full CAT 4 view. It won't offer you that option at all. But then it's fairly straightforward, and like I said, the user guide will talk you through the details in there. All right. Well, thanks everyone for your time.